Hi, welcome to the channel, Caravan Vlogger. Today's video, something slightly different. I've been asked by a few people to make something like this. So I've done a blog on this subject. It's a men's health subject. Now, some of you may know that before we went to France recently, I was feeling a bit unwell. So we'd had a month booked to France, and 3 days before I was feeling particularly unwell with trapped wind, very tired. But I've been also getting up twice a night to use the toilet. Now if you Google that, it's not particularly anything to worry about. I'm 55 years old. You will maybe get up once or twice. So we went on holiday anyway, and almost the first night in France, I'd got up maybe 4 times to go to the toilet, which is obviously a lot and makes you very tired because you're getting broken sleep, maybe an hour and a half sleep and you're waking up. So the further we got into the holiday, I was weeing and getting tired. Then I noticed I was feeling really thirsty during the day as well. Put that down to the hot weather. So I was drinking lots of Coke and lemonade, water, anything. I just had this real thirst. So old friend Google again. I'm diabetic. This is strange. No one in my family has a history of diabetes. So we obviously stayed on holiday. When we came back, I booked an appointment to see the doctor. I had a blood test. A few days after that, I was in work. I work in South London, so maybe 2 hours from where I live. Doctor said, "We've had your blood tests back. Can you get to an A&E department?" I'm like, wow, this is like 9 o'clock in the morning. Sent me into a bit of a panic. Kidneys were down to 22% capacity, which is very poor. So the doctor said it's either total renal failure or enlarged prostate. So of course, the two of those, I understood what an enlarged prostate was, but didn't really understand a renal failure until I googled it on the way home on the train, and so it's kidney failure. I was thinking, well, it's okay, I don't have any symptoms. If I had kidney failure, I'd know about it. Of course, you Google a bit more and it says you won't know any symptoms. The first you know of it, basically you die. Oh, Jesus. So this is getting a bit more stressful. So I went to A&E. I had to go to the doctor's surgery to get a letter. Went to A&E, and it turns out I have got an enlarged prostate. So this is the thing about men's health. For me, anyone mentions prostate, I instantly think of cancer. So straight away I'm thinking, Jesus, I've got cancer, and this is getting worse. I didn't feel unwell. I felt tired, and I was going to the toilet a lot, but not unwell. So anyway, into A&E, get to see doctors. So the blood test said it was basically a prostate issue, not a kidney failure, which I guess was good. Still got this cancer thing hanging over my head, thinking, well, this isn't good. So they inspect the prostate. Actually, okay, before that, I have a bladder scan. So they do a scan to see how full your bladder is, and my bladder had 1 litre of urine in it. So our first question I asked, is that a lot? Yes, it is a lot. Doctor asked me to go to the toilet, empty my bladder and come back, and he'll do the scan again. So I went off to the toilet, had another wee, came back. The doctor had just popped out somewhere. So a couple of minutes later I said to Mandy, you know what, I'm going to try and have another wee because I know how they're going to empty the bladder, and I'll do it myself. So I went back to the toilet, managed to go again. Wasn't sure how much I'd weed out. Eventually the doctor came back, did another scan. Basically I'd weed out about 300 millilitres, which is about the size of a Coke can. Well, that's not a lot. He said there's still 700 and whatever millilitres in your bladder. We're going to have to drain it off, which means fit in the catheter. I get to see another doctor. He fits the catheter, which look away now if you're squeamish. But it's so what he does, he squirts like an anaesthetic gel where the catheter is going to go, which is kind of uncomfortable, and then he puts the catheter in, which isn't as painful as you might seen. But he says to me, "Oh, did you feel there was a bit of resistance to it going in?" I said, "Well," he said, "well, that's your enlarged prostate getting in the way." Oh, okay, thanks for that. So obviously then the urine's is able to drain. But another hour goes past, and he says, "Right, I need to inspect your prostate." And while he was gone, again googling, so I Google digital rectal examination. I thought, well, that's all right. Digital to me means obviously not physical. It means it's going to do some sort of scan, but no, digit actually means her fingers. So anyway, he inspects the prostate, which isn't actually as bad as it sounds. It is uncomfortable, but isn't at all painful. He says yes, it's enlarged, but by the feels of it, it's benign, which is obviously good. If they feel it and it's bobbly, apparently it indicates it could be cancerous. So anyway, I'm admitted to a ward, and cutting what is turning into a very long story short, I stay in hospital for a week with the catheter fitted, drinking fluids, measuring how much is going in, how much is going out. I had a ultrasound scan on my kidneys and bladder. Guy said that my kidneys were enlarged. So basically what happens is the bladder is always full. They're putting pressure on the kidneys, and they start to fail. So the reason they put a catheter in is to make sure there's nothing in the bladder, nothing stays in the bladder, give the bladder and kidneys a rest, and over a period of time they'll sort themselves out. So anyway, after a week I'm let out of hospital. Now downside is I do need an operation to basically trim the prostate, because I'm relatively young to have this condition. Now all men's prostates grow from the age of 25. They don't really know why, but they do, and most men, the symptoms aren't bad enough that they need any sort of treatment at all, maybe tablets, and that's basically if you're a bit fed up with how many times you're going to the toilet, they give you tablets which potentially shrink the prostate down to a reasonable level to allow urine to flow. Now the problem is with a prostate, it's behind the bladder and it presses on the tube that goes from the bladder to your penis where you pee, restricting the amount you can pee, which is a problem I had. So I've got this catheter on for 6 to 8 weeks when I have the operation to trim the prostate. So really the point of this video is obviously not caravan related, but it's for men, because so what I've noticed is we have over 1,000 subscribers now. Thank you very much for subscribing, by the way. So we have nearly 1,200 subscribers, and well over half of those subscribers are male over 55 years old, so my age or a bit older. So a message to you: if you're peeing at night, don't be scared to go to your doctors. You should actually go, tell them. They're all very understanding. This common thing. You could end up having tablets, or you might have to have an operation, or God forbid it may be cancerous, so if you catch it early they can start treatment. Now there's obviously an internal examination, as I said. Now think of it more like it lasts literally 5 seconds, and it's kind of more like a prostate massage, I call it. It wasn't unpleasant. I know the NHS have this thing where it won't be painful, it will be uncomfortable. This was a bit uncomfortable, but it's kind of I say embarrassing. It's not really embarrassing, is it? But it's not really dignified. You laying on your side and some guy examining your prostate. So do get it checked out. It's worth, just even if you've any concerns at all, just go. And like I say, they're very understanding. They know about it. It's a very common issue, and the treatment isn't necessarily as bad as it could be. But if you leave it too long, then you could end up damaging your kidneys. Oh, one other story there from A&E. So the guy that's fitting the catheter, the doctor, it fits it, and I was in a bit of discomfort, pain, after about an hour, and he said, "Oh, it can sometimes get air in the tube." So he said, "What I'll do," so he grabs hold of my penis and starts to squeeze it, and he says to me, looks at me, he said, "Are you okay?" And I must have given him a funny look, and he said, well, I mean, considering you've got a man squeezing your penis, I suppose. And I was like, there is a little bit of humour which kind of broke the ice a bit. It was like, okay, maybe this isn't quite so serious, I can just relax a bit. And there's humour in most things, I guess, but also things need to be taken seriously. So gents, if you're peeing at night, it's absolutely not normal, and there could be a problem, so please go and get it checked out. It's really, I mean, if I could go and get it checked out, then anybody can. It's, a blood test, maybe examination of the prostate, and that's it. And they can diagnose it really quickly, and hopefully it's benign, and it could be treated by tablets, or worst case, as with me, it's a small operation. There's no incision. Basically, they put a camera up into your tube where you pee. A camera's with as I read it, there's a bit of wire attached, which is hot wire. They go up to the prostate, take a snip off, and then flush the bladder out. General anaesthetic. No scars to tell anybody. You'd need a catheter in for while you're in hospital, 3 days I think at maximum you're in, and you're out, and you're as right as rain. Now the kind of downside is, I was reading, the prostate probably still continues to grow, and you could, in another 20 years time, I might need the same procedure again. Not everyone's prostate grows so much that they necessarily need treatment, but it's worth getting it checked out. Anyway, thanks for watching. I promise the next vlog you see from us will be caravan related. We've got a few ideas. In fact, if you probably watch the next video, I'll be wearing the same shirt because I plan to do it straight after this one.